It's good seeing all of you. For those who are just arriving back, it's good having you back. For those who have been here, it's been good having you here. I thought it would be good for us to get together once everybody was back on campus and talk about what we're going to be doing this year, and for me to lay out some of the things that we're going to be doing related to coronavirus in particular. I've got Dr. Jeff Stevens with me, who is really one of the top infectious disease people in the region, and we're fortunate that he's a member of our faculty in the School of Medicine. But he knows a lot about coronavirus, not from reading about it, but from treating patients who have it. He spends a good part of every day treating patients who have been infected with coronavirus. So I think he will have insights that will be valuable to our discussion. I've had some people say, well, why are we here? We should all be at home. The fact is that Mercer is not an online university. This program is a residential undergraduate university. In the best sense of the word, it's an institution that's known for a highly engaged undergraduate learning environment. It's an institution that's known for the quality of interaction between our teachers and our students and the kinds of outcomes that quality interaction produces. It's a place where students work one-on-one with faculty doing research. And the fact that we've been the #1 producer among all engineering schools in the world for the last 2 years in a row in Goldwater Scholars is a reflection of the quality of that interaction. Those are scholarships awarded to students in the STEM disciplines based on the quality of undergraduate research that they're involved in. You don't get those results without some great quality interaction in our research labs between our faculty and students. Likewise, we're a place that is known for the quality of service learning programs that we're involved in, and especially, I think, service learning programs in support of this community. Things like the reading tutoring programs that we do with children from disadvantaged backgrounds, things that are very difficult to do unless you've got a real commitment to service learning and to engaging your students in service learning. We're known for integrating service learning with research in international settings. That's what the Mercer on Mission program is all about. And I think all of us are proud of the outcomes that flow from programs like Mercer on Mission. Expected outcomes and unexpected outcomes, like a Spanish major who goes to Ecuador to serve as a translator with a group of chemists and engineers and comes back with the idea of starting a coffee shop and now has a thriving coffee business. Those kinds of outcomes that I think all of us are proud of and should be proud of. So that's what makes Mercer special, those kinds of opportunities, and we are very committed to preserving what makes Mercer special. We know that we can't do that online. We can't do that online. In the spring, we had to vacate in-class instruction for the last portion of the semester because we hadn't had time to prepare to make the campus safe enough during that period of time. But fortunately, we've had several months now, more than 4 months to get ready. We've worked hard at it. We've met almost every day for the last 4 months. We have consulted Dr. Stevens more than he wants to be consulted, more than he has time to be consulted, as we've been working through different procedures that we can implement to ensure that our students and our faculty and staff are working in as healthy environment as is possible, given our imperative of preserving what makes Mercer special. So we want you to be healthy. We want our students to be healthy. We're not going to be perfect by any means, but we've worked hard at this. One thing I want to emphasize is we need every one of you to do the best you can to follow the protocols that we have set out and to be careful in terms of your own health. We need all of you to be as diligent as you can be. So I want to talk about some of the things that are included in our protocols, and in the course of that, I'll attempt to answer at least some of the questions that you all have asked. And I'm going to ask Dr. Stevens to join me in doing that. Masks. This is kind of a funny mask I've got on. I don't think it would be good for you. I think it protects you from me, but I don't think it does much to protect me from you, because there's a hole at the top, which allows me to speak and be heard. And we're trying it out to see how well it works. But masks, we want everyone wearing masks indoors. We want everyone wearing masks outdoors when you can't distance. If you're sitting in your office with no one around, you don't need to wear it. One of the questions I got was, does an office count as enclosed within the terms of our policy if your door is open? And I think it's fine if your door is open, as long as there's nobody close by. I think that's fine. Jeff, what do you think?
Yeah, obviously, if there's a lot of traffic in the hallway right outside your door, that might be a different issue. But if you're, again, people rarely come by, they're not congregating, I think it's fine to do that.
I don't think they can hear you, Jeff.
Did you hear me? I said if your office is next to a very busy hallway and people are congregating there, that might not be appropriate. But if people rarely come by, you're working in your own space that's enclosed, again, the risk is, and I'll talk about that because there's a lot of questions about transmission, and I'll talk about that. But the vast majority of transmission is from droplet, and that's why some countries have 1 meter. Some places like here have 2 meters. If you're at 2 meters and most of the transmission is droplet, you have about a 1% chance of transmission. At 2 meters, it's about 2% chance. Next to somebody, depending on your medical troubles and all that, it's probably 10, 15%, maybe as high as 20 or 40. Some say as low as 5. But the further you're apart, so if you're, in your office, you're the back of the office, you're at least a couple of meters from the hallway, you should be okay with the door open.
Yeah, I had a question, Jeff, while you're up.
Oh, sure.
Someone says I work in a cubicle, and if I'm in my cubicle by myself, do I need to wear a mask? And I think that's going to be between the employee and their supervisor, and I think it's going to depend on the same things Jeff was just talking about. How close are your fellow workers? If you've got fellow workers within a couple of meters, 6 feet.
And you have 4 people in a room around a cubicle with a divider, and you're all talking during the day, then that would be a situation where you need to wear a mask.
Yeah.
And that's pretty clear.
But if you're in there
and
there's nobody nearby, and the fact that your cubicle doesn't have 4 walls around it, I don't think matters.
No, it depends on how many people, how long, and you're in the same space. And so if you're at your own cubicle and there's nobody else around, no reason to not do it. But if you had people there for many hours working on the phone, talking, and you're nearby, then you would obviously want to be masked.
Okay, we certainly are asking people to distance. You all are appropriately distanced as I look around the room, especially given that you're all wearing masks. But we want you to distance to the extent feasible, which means that most of the time we want you wearing your mask and and sitting apart from one another, as you are now. Our on-campus dining facilities have been arranged to permit distancing while eating, because you obviously can't wear a mask while you're eating. So we've worked with the health department to set those dining facilities up so that they permit you to distance. I eat in our dining facility usually once, sometimes twice a week, and there's not perfect adherence to distancing, I have to say, but we're going to be shooting for that. You want to talk about that?
Well, and again, I think that's the places where you have congregation is probably the biggest issue. And again, even at the hospital where we try to do that, we've actually made the cafeterias as best we can. But obviously, if you have family groups or people who are together a lot of the time, they tend to congregate there. But that's the places where I would be most concerned, because you are going to take your mask off. And so I think you need to be very cognizant of that whenever you go to congregate settings. And the cafeteria would be the big one on campus, I would think.
Yeah. We are going to try and do daily temperature checks. Each of you has or will receive a Bear Care kit. There's just a little digital thermometer in there along with some other things. We'd really like you to take your temperature every morning before you come to work. And if your temperature is above 100.4, we want you to call Mercer Medicine and not come into work. That means you've got a fever that's above the threshold, and that doesn't mean you have coronavirus, but it means that we want you to talk to somebody at Mercer Medicine, and they'll advise you how to proceed. But the main thing is to stay home until Mercer Medicine has told you that you're clear to come to work.
I was also going to say that 20 to 40% of people with COVID are asymptomatic, and they don't have fever. And fever is nice, but it's not enough, and that's why masking is important, because if you have asymptomatic infection, which, as I said, 20 to 40% of the time people do, they can pass it to other folks. And so masking is really more for your fellows, your coworkers, your teammates. And yes, it's somewhat for you. And as President Underwood said, he's wearing a shield to disrupt aerosols, and that's fine, but that doesn't protect him very much because of that. So and I think that people have lost that for masking. It's just as much that if you have it, to pass to others. And that's why I think it's very important that we mention that. And again, that asymptomatic infection is a significant part of this. And that's why it's difficult, and that's why temperature checks alone are not enough. But obviously, that's pretty low-hanging fruit. If somebody has a fever, again, it doesn't have to be COVID, but it obviously indicates something is going on, and that needs to be addressed.
Yeah, there's no one of these things alone is sufficient. The hope is to have enough things going on together that they're effective. We have a number of infrared thermometers that we've purchased, maybe a couple of hundred, Jim? The idea is to not have an infrared thermometer for every individual person. If I had one, I'd play with it all day. But to have one in each office, like to have one in the athletic offices, and hopefully everybody in those offices can be double-checked every day to make sure that their temperature is not 100.4. Again, we know this isn't perfect, but it's part of a package. We're also in the process of evaluating some equipment that we can install in high-traffic areas. This equipment was designed for airports to measure temperatures as people are passing through airports. We're testing it now to see if it's something that could work here. For example, having one at the entrance to this arena, having one at the entrance to some of our food service facilities, maybe some other places as well. It's just part of a network of protections. Symptom monitoring. Jeff mentioned that a lot of people with coronavirus don't have fevers. They may have other symptoms, coughs shortness of breath, difficulty breathing, chills, sore throat, loss of taste, smell. Anything else you can think of?
Some young people have noticed some funny rashes on their feet. I've actually not seen that. And
Yeah.
the CDC has added a few things like the taste and smell. And we've actually had a couple of people, that's how they sort of presented, was the loss of taste and smell.
Yeah.
And most of these are pretty much what you see with most viral illnesses, even though there's some peculiarities. And again, people will be different. There can be a lot of diarrhea and GI symptoms also. So
Yeah.
unexplained GI symptoms also have been associated with COVID.
So if you have something that strikes you as a potential symptom, what do we want you to do? Yeah, we want you to stay home until you've talked to somebody at Mercer Medicine. And the person at Mercer Medicine might talk with you and you say, look, I had a cough this morning, and they'll ask you, is that unusual? And you say, well, no, I cough every morning. They may say you're clear. Don't worry about that. On the other hand, they may say, no, come in, we want to take a look at you before we clear you to go to work. But if you have something that you think is potentially a symptom, it's probably not, but we want you to talk to the people at Mercer Medicine before you come in.
And we have a dedicated line for that and people to answer it. So again, that's something that has been stood up in the last 4 months, and we're going to make sure that we can take care of folks whenever we get called and can deal with that, so that folks can feel like they're getting the appropriate attention.
So hand sanitizing stations are now ubiquitous on campus. They're installed near the entrances to every building. Every office should have hand sanitizing materials there. If you don't, then talk to your supervisor and we'll get it there. Wash your hands frequently. Take advantage of these hand sanitizing stations. We've obviously done away with social conventions like shaking hands. Is this still important, Jeff?
It is, and again, hand washing, and this is probably in my life, I'm probably 99% hitting the hand sanitizer before and after I see a patient. I'm probably as close as a human can get to doing it 100% of the time. But I have to tell you, hand washing, it takes time. And to do it correctly, you really have to sing the little ABC song. It's more than 20 seconds, A, B, C, D, you don't want me to sing, obviously. But you have to have a little ditty because most people wash their hands in a few seconds. You really have to do it for 20 plus seconds. And many years ago, there was a time motion study done of ICU nurses that if they washed their hands in a 12-hour shift appropriately taking care of patients, they'd be washing their hands 2 hours a day. They wouldn't have any skin left. But when you do wash your hands when you go to the bathroom, it ought to be for 20 seconds, and then the hand sanitizer the rest of the time when you're going in places and whatever. But hand washing, and it doesn't matter about hot water, cold water, the data doesn't really make a big difference on that. But it needs to be about 20 seconds. So do a little ditty, sing a little, to yourself, because I think that's I'm probably not the 20 seconds like I should have been over the years.
Yeah, the temperature of the water doesn't matter, but using soap does matter.
Soap and water, yes.
Yeah. We've arranged with National for enhanced cleaning protocols around campus. You'll see them doing some things that they didn't once do. There are also bottles of disinfectant that are being spread around the campus so you can wash down surfaces and disinfect them. I've talked to Jeff about this. This may not be as important as we once thought it was. Why don't you talk about virus on hard surfaces?
And I might as well take the time to talk about transmission in general, because that also will cover a couple of other questions. Viruses are spread in different ways. Obviously, you can be spread oftentimes when you get into your mouth, or your eyes, to your airways. And most of the time, at least with COVID, it is with respiratory droplets. And again, whenever you cough or sneeze or talk or sing, you are aerosolizing things. And again, when you aerosol, like when you see people spit or whatever, or just when they're talking, you have little droplets in the air. And most of the time with COVID, it's 5 to 10 microns or higher, and those tend to fall out after a couple of meters, 6 feet. Now, if you sneeze, yeah, maybe it's further. And we have other germs like TB that whenever you aerosolize, they're smaller than 5 microns, and they can dry, and they get on the little dust motes, and they can float around for a long time. And that is a way that COVID can be spread, but we think it's the minority. And in the hospital, when we're doing things to make people cough or put them on ventilators and things like that, we pay extra attention and use the other kind of mask, the N95 mask. And that's what we call airborne transmission. Measles, for example, is an airborne pathogen. If somebody with measles was in this auditorium and none of us had measles and they just walked around, we'd all get it. You don't get that. COVID doesn't act that way. It has what's called an R0, which is the transmission of about 2.5. That means the average person with COVID can spread it to 2 or 3 folks. That's about like flu is as far as transmission. It's not like measles. We'd be in a lot worse shape if it had that kind of transmission as measles. Are there cases where airborne can be through a vent or that sort of thing? It's probably possible, but it is not acting that way. There's a nice article in the JAMA, the Journal of the American Medical Association this week, one pager that looks at sort of the pros and cons of all that. It looks like now, based on the evidence, that most of the transmission is still by droplet, which is why the 6 feet thing makes sense. But obviously, when you sneeze or cough, it lands on a surface. If it's the right temperature and humidity, metal, wood, it may stay there for a long time, maybe hours to days. But the problem is, how much when you touch that and you touch your face or eye, can you do that? It won't just, if you touch your hand, it's not going to do anything. It's not going to get into you. You have to get it in your face or your mouth or your eyes. And people look, sometimes we touch if you look at it, folks touch their faces 1,000 times a day. It's another reason why masks are important. Because if you're doing this and you don't realize you're doing that, you have something in the barrier. But that is the minority of cases. It actually is hard to prove that anybody's gotten it from what we call a fomite surface. Though there was a ID doc who was coming back on a plane from Boston or New York working during the bad time up there, and he said he was masked the whole time. He went back to New Orleans, and he thinks he probably got it from his eyes, from probably touching something. And he's talked about this. But I will tell you, touching things is not the way you get this. It looks like the majority of the time, it's from respiratory secretions. And that's why masking and distancing and hand hygiene, so if you do get it on your hands, you don't get it, introduce it into your face, eyes, mouth, should work. And that's why people worry about airborne. Airborne is probably a thing, but it's the minority, just like surfaces. It's not the majority. The majority is respiratory transmission.
Yeah, I asked Jeff one day when he was visiting with me, I said, so if I sit down at a table and it's a dry surface, but somebody who had coronavirus was there before me, am I going to catch it by putting my hands on that table and then rubbing my nose? And he said, if the table's dry, even if the virus is there, there's not going to be enough of a viral load for you to catch it. Now, he said, if they, left fluid on the table and I put my hand in it and then put my hand to my mouth, I might catch it then.
And it is theoretically possible from just that surface, but it is the minority. It is hard to do. And again, but it doesn't mean that you shouldn't wipe things down. It shouldn't mean that you shouldn't do all that, but that is not the major way that this is transmitted so far. And there are going to be, there's always exceptions to every rule, okay? Hardly anything in medicine is black or white. The good news is that we know now that the majority of transmission is the way that we know it is, and we know ways to deal with it.
Okay.
And we can try to mitigate the others.
So we've put a lot of effort into building testing capacity on campus over the last 4 months. Mercer Medicine can administer tests all day if they need to. We built a test processing laboratory on our campus that's now operating under an FDA license, and it does high quality, accurate testing and we want to use it. So if you fear you've had exposure, we want you to call Mercer Medicine and tell them you want to get tested, and we'll do that. That's why it's built, that's why it's there. We don't want you to sit around wondering, worrying. Call Mercer Medicine and tell them you fear you've had an exposure, and they'll probably get a doctor on the phone and talk with you about the source of your fear, and then we'll get you tested. Something that we're doing here in Macon that goes beyond what Jeff recommended, but we decided to do it anyway, was we are testing every one of our undergraduate students who comes back. We just sent out notices earlier today telling them what the testing program would look like. We understand there's limited utility to this. Jeff explained the reality that what the test will tell you is if they have it at the moment they're tested, it won't tell you if they got it driving home from the testing facility. So there's some limited utility to it. But I think at least up front, as people are coming in, we'd like to know that we have as clear an environment as possible. So every undergraduate student, whether they live in Mercer-owned housing, whether they live in the lofts, whether they live off campus, whether they commute, every one of them will be tested when they arrived. And those that test positive, we'll get them in isolation and get them access to instruction while they're in isolation until they're cleared to join us on campus. And that testing will begin on Monday when we're testing all of one of our sports teams. Those folks are already here, and we'll proceed to do that. But again, I want you all to hear that if you have any reason to believe that you've had exposure, I want you to call Mercer Medicine, and we can get you tested, and they can relieve you of any concerns that you have. You want to talk about testing?
Yes, and I think that when you're exposed, again, we quarantine people, and this is where the semantics. Quarantine means that that you may have been exposed and you're trying to watch. If you are actually positive, you're isolated and you're self-isolated. But when you're doing testing, after you're exposed to somebody, it's probably between 2 and 7, maybe 10 days before you get actual infection. So if you're exposed on a Monday and you're concerned, we probably wouldn't test you on Monday because it would be too soon. It might be a couple of days later or end of the week. We might say, hey, watch for symptoms, and we'll test you in a few days. And for peace of mind, maybe we do that. But you wouldn't be tested the same day that you're exposed because there's not enough time for you to develop an infection. And
That's why we want, when you call Mercer Medicine, they're going to want you to talk to a doctor because they're going to want to make sure that what you want is something that makes sense in the circumstances.
Absolutely, and I think that our testing lab is only one of the 12 or 14 in medical schools in the country that are set up and are approved. It's really a yeoman's amount of work. I was pretty late to that group, but I have to say it was an amazing amount of work, and to have that ability here. And I've used it, and I'm not ashamed. I have a family member now with COVID in Atlanta who's very sick, my father-in-law, and he has cancer, and looks like he's going to make it through. But my sister-in-law was exposed to him whenever he was taken to the hospital, and we didn't know that. And I said, wear your mask, and she didn't do it. And so I brought her down here and tested her because I know that we can get the test in a timely manner, and I used it, and I'm not ashamed for that because we have that capability. And I think it's something that we should be very proud of, and I think it will help us if we do have an outbreak or we have issues with a team or something like that. We will have the ability to look at the contacts and be able to say, we can get you tested in a timely manner, and I think that will allay a lot of people's fears.
Yeah, we want to use it. it was expensive enough, we want to use it. A number of questions that you all submitted related to what do I do in this scenario. I've said this before, I'll say it again. If you feel symptoms, stay home, contact Mercer Medicine. They'll decide whether your symptoms are such that you should be tested. If they decide you need to be tested, you need to stay home until you get the results, which they're telling me can be had between 24 and 48 hours.
So far, so good.
Yeah, it's taken us a while to get to that point. Early on, it was taking us 4 or 5 days sometimes, but we think we're getting to the point where they can turn them around in 24 hours if you're tested in the morning and 48 hours if you're tested in the afternoon. So if you feel symptoms, stay home, call Mercer Medicine. They'll tell you whether you need to be tested. If you're tested, you stay home till you get the results. If the tests confirm you have this virus, you'll need to stay home until the folks at Mercer Medicine tell you you're clear. But generally speaking, they're going to be following this document. This is a protocol that's been developed working with Jeff and the folks at Mercer Medicine and talking to regional public health folks. This is our Bible in terms of protocols for what we do in different scenarios. You will find it on our website under the COVID site that you get to from the front page. Is that right, Larry? What I'd really like is for every one of you to go to that site, to print this off, to read it carefully, keep a copy on your desk and keep a copy at home. And that way, when you have a question, you can look it up on here, and I think it's pretty clear. It describes the scenarios of what to do if you're tested positive, what's going to happen, what to do if you're feeling symptoms, what to do if you feel like you've been exposed, and walks you through each one of those. And this is the document that Mercer Medicine is going to be using to advise you. This is our coronavirus protocol Bible. It can only be changed
By fiat.
by the Council of Nicaea. We've worked hard on this. We had a situation this summer where a young woman returned from home and on the third day of class developed symptoms, and it turned out she had contracted coronavirus, apparently from her mother, who was at home with it. And the question was, do we have to quarantine everybody in the class? Quarantine's not a word that's used on this document because it's understood in different ways. But the question was, in essence, do we have to shut down that class? And the answer was no. People were distancing in the class. They were all wearing masks. We told them that a student in the class had tested positive and to watch themselves carefully for symptoms. And 3 weeks have now passed, and none of them ever showed any symptoms. And when I talked to some public health people about that scenario, they said if people are sitting apart and they're wearing masks, even though they're in the same room with somebody who has coronavirus, the odds of one of the other students having been infected is very small.
It's probably less, I would say probably much less than 1%, probably 0.6%. But again, and that's what you have to do to make decisions. You have to understand the dynamics there.
Yeah, so please take my advice and go to the website and print off at least a couple of copies of this, one to keep with you at home and one to keep in your desk. And I think if you read it carefully, it'll answer a lot of the what-if questions that were submitted to us in advance of the meeting. I'm going to go through these questions. Candace, are you going to read the questions? Why don't you read them, because they're printed so small on my page, I can't read them.
You've answered a lot of these already, but I'll go down what we have. If Governor Kemp's executive order regarding gatherings extends into August, what does this mean for commencement and any other indoor gatherings that we offer to our students, faculty, and staff in the early part of the fall semester due to the number of participants?
Yeah, there's nothing new in the executive order concerning gatherings that he signed yesterday. The main new feature of that order was rescinding some of the local masking requirements. But there was nothing new in terms of gatherings. What the order with respect to gatherings has said for several months now, in essence, is avoid gatherings of more than 50 unless you're in a big enough space that you can appropriately social distance. There's also an exception that would cover this meeting in any event, because there's an exception for meetings of faculty and staff in preparation for the 2020-2021 academic year. But we didn't need to rely on that one because we're in a big enough space that people can spread out, and with you spread out wearing masks, I think this is a very safe environment. In terms of commencement, those commencements have been planned with those requirements in place. In fact, the ones in Atlanta are in a facility that mandates compliance with those requirements. So if you attend one of those commencements, we will have the students spread out. They will have plenty of distance between them. They'll be wearing masks, except when they walk across the platform and have their picture taken. And they'll be up there either alone or with just me. I'll have to talk to Jeff about this. There will be friends and family, but we've pretty sharply curtailed the tickets available. Only 2 tickets for each graduate, and we've done the calculations and the measurements. We will let a husband and wife or partners sit together, but outside of family units, people will have to distance. Do you have anything to add on that?
No, I think I saw the West Point graduation, and they had them all in the field spread out, and it was pretty interesting to see, because I know always they throw their hats up at the end, so they probably could like frisbee them to each other because it was that far apart. But I mean, again, I think that there's ways that you can do that, and again, obviously, it sounds like that's been attended to. And I would also say that as far as when we talk about an exposure to somebody, we usually talk about the within 6 feet for 10 to 15 minutes. So if somebody's walking past you, it is possible to get COVID from that. But again, it's a time and all that. So if somebody walks up and you hand them something and they're walking past very quickly, that certainly is not 10 minutes and within 6 feet. So probably...
So I'm good, I can stand up there.
Well, yeah, it's just they need to walk fast. So
Well, they're not gonna walk 15 minutes, so, yeah. Okay, Candace.
Will there be a reporting system so that campus community can see the rate of COVID-19 infection at each campus location?
Larry and I have talked about that. Some places are starting to do that. I saw the University of Georgia reported maybe 10 days ago that they had 147 positive cases on their campus in Athens over the course of the summer, which seemed pretty high to me. Because they don't even have in-person classes right now, but 147, I think their students must be spending a lot of time in bars downtown. At the time, I called Larry and asked him how many reported cases we'd had, and 10 days ago it was 2. I think it may be 5 or 6 altogether now among our students and 1 staff person. But I think we are going to have something that we put out every week or 2 on where we stand on that. We'll certainly have cases, you all. Everybody does. Everybody will. My former university, in the distant past now, has an athletics-specific counter on their website. And I looked before I came here to see where they were, and they had 37 student athletes who had tested positive this summer so far. But I think it's a good idea. I was reluctant to put it up when we had only 2 cases because I figured nobody would believe us. But maybe now that we're up to 5 or 6, we'll have a believable number to put up.
How will the institution address the increasing concerns from students regarding an online instruction option?
Well, there are some students concerned about that. We are not an online program. This is a traditional residential campus. We believe in what happens in that format, and we're not going to switch to an online format. We looked in the spring at trying to do both formats simultaneously, and it can't be done in a quality fashion. It's too big of a burden on the faculty to ask each faculty member to teach their class in an in-person format and an online class format at the same time and do it well. And we can't afford to double the size of our faculty, even if we could find twice as many qualified teachers. So it's not a format that we feel good about. It's not a format that can be combined with traditional format, and we know that it's not what students are coming here for. Yes, there are some who are demanding an online option, but that's not what the vast majority of our students are coming here for, and we know that because we talk to them and we hear from them. And by my estimate yesterday, not only would we lose all of the undergraduate research opportunities that we're so known for, not only would we lose things like Mercer on Mission, not only would we lose all of our service learning programs, not only would we lose the learning that occurs between students on campus, which is some of the most valuable learning, we'd also lose about half of our undergraduate students, which means we'd lose about half of our faculty and staff. That's not necessary. We can do this, you all. Scott, do you have anything to add to that? What's that? Okay.
What is the protocol if you've been in proximity of a person who tests positive, and are there parameters on the nature of the proximity, such as being a roommate, teammate, or coworker, that determine what you should do?
Yeah, this is, when you get this protocol sheet, that's number 3 on the protocol sheet. It depends on how close the proximity is. Jeff was mentioning 6 feet, 15 minutes. That's what they'll tell you when you talk to the folks at Mercer Medicine. And what happens at that point, if you have been in that close a proximity to someone who's been infected, is we want you to talk to the folks at Mercer Medicine. They will probably tell you to carefully monitor yourself for symptoms, to make sure you're wearing your mask, to make sure that you're socially distancing. And they may tell you, depending on the circumstances, come on in, let's test you. But you need to call Mercer Medicine and follow their advice.
I think that's entirely, as I was saying earlier, that's what we do at the hospital, and that's what we put in, because that's actually what a contact is you have to have a significant amount of time around somebody. And of course, if you're masked and you're doing hand hygiene and all that, your risk should be minimal. But when you've been sitting next to somebody who's a friend or whatever, and you're not socially distanced and they turn out to be positive, then we obviously would need to monitor you more closely and make some recommendations. But we would ask you a few questions, because that, again, it might not be the same for each person.
What is the protocol if you've been in close proximity of a person who is waiting for test results? Should you quarantine as well?
Jeff?
Well, if they're not symptomatic, even though, obviously that might make some difference, but if they're masked and you're masked and they're waiting on a test, then it would be the same thing. You would just observe.
If a student gets sick or tests positive, where will they go?
They will go to the Student Health Center, and if their sickness is of a highly contagious disease, like coronavirus, then we have spaces set aside where they can be isolated and cared for on campus. So far, we haven't had many students test positive, but we haven't had anyone take us up on our isolation spaces, which are actually pretty nice. What they tend to prefer to do, we haven't had an out-of-state student test positive that we know of yet. What they tend to do is want to go home and just wait it out at home. But we have a number of isolation spaces set up for those students. Mercer Medicine will also talk to them about who they've been in contact with and do appropriate contact tracing. And we'll notify students who have been in contact with someone who's tested positive and give them advice as to what they should do. Does that answer the question, Candace?
I'm assuming so, not my question, but I would think so, yes.
The reason Candace is reading them is because we can't hear you all with those masks on. So we ask you to submit the questions in advance, and then Candace can read them.
For employees who have underlying health conditions as stated by the CDC and who can effectively work remotely, will they be allowed to do so?
That's entirely an ADA question, and you all, Candace, will be working with them and following the ADA guidelines. They'll have to have an appropriately diagnosed condition, and then you all will make a determination as to whether working at home is a reasonable accommodation in the circumstances. It's an ADA question.
If a student or staff member in close contact tests positive, what would be the impact to the operations of the office or department?
Well, read the question again.
If a student or staff member in close contact tests positive, what's the impact to the operations of the office or department?
Well, obviously, they lose that student worker or staff person until they're cleared to return to work by Mercer Medicine. And then we just apply the protocol to co-workers as specified. And that is, we'll want people who have had contact to talk to the folks at Mercer Medicine. And Mercer Medicine will likely tell you to monitor yourself closely, to be fastidious about wearing your mask, to maintain distance, and they may tell you, depending on the circumstances, come on in, we want to test you.
I think that's 100% correct.
And final question, what job protections will be afforded to high-risk staff and staff that test positive?
That's just an ADA question. Yeah. You all can answer those, what the protections of the ADA are. I haven't looked at it in a long time. Okay, those are the questions. Jeff, you want to make any closing remarks or provide some additional insights to us?
I was just going to say an anecdote and then say a couple things, is that I was at a dinner party in the 1990s, the neurology group here, and there was an older fellow, and I was chatting with him, and he said, what do you do? And I said, well, I work at Mercer, and I'm one of the infectious disease docs. He said, well, I was an administrator at Mercer back in the 50s. I said, really? And I said, that must have been a very interesting time. And he said, yes. He said, especially in 1957, when we had the pandemic flu. And he said the Student Health Center was full of folks lying on the floor and all that. And then it made me think that, this is not something that we're not going to see again. The World Health Organization always talks about pandemics that we're either pre-pandemic or pandemic. We're never that's the two settings we're in. And I think Americans in particular, just like when a hurricane destroys the house in Florida, people immediately rebuild it because I guess they think that never is going to happen again. Well, things do happen, and I think our resilience and our approach to these things ought to be based on science and reason. And sometimes I think all the noise these days has made this very difficult for people to think about. And you hear things and read things, and it really is not that complicated. It's a viral illness. Again, it's worse than seasonal flu. It's not as bad as a lot of other viruses, but it's bad enough. And it's bad because it's novel and that we don't have any immunity de novo to it. And most people don't, of course. And this will happen again. And I think that institutions, we need to be able to deal with these things in a way that makes sense. And I think that the university has spent a lot of time this summer looking at the physical plant, the workflow, the logistics to really try to address this in a way that makes a lot of sense. And I think that, again, perfect is the enemy of the good. I think we've done more than good. I think we've done very well. But COVID is going to be an issue for the next 6, 12, 18 months unless we get a vaccine. And if we do early, then can they ramp it up? Who's going to get it? Probably health workers, those at risk. A lot of issues about that. And my bet is we'll probably see this, if we're going to get it at all, maybe not this fall, but next fall. So I have every suspicion that we're in the second inning of a 9-inning baseball game. So dealing with this is something that we need to be for our families, our community, and our institution. We need to learn to do the things that we've been trying to promulgate, to try to model. And again, we need to be a good model for the rest of our community. And we try to do that at the hospital because I think a lot of people, even people that I work with, the minute that they leave their institution, they take their mask off in public, and I find that problematic. I was picking up dinner the other day, appropriately masked, and one of my surgical colleagues came in, no mask, around other people, and I was very upset by this because we, want to care for our fellow man, and this is an easy way to do something that would be terribly helpful to society at large.
Yeah, I'm working with, a number of us are working with the hospitals in this, our immediate region, Navicent, Coliseum, and the hospital over in Warner Robins. And we're working on a campaign to encourage people to wear these things, pretty much in line with the policy that we sent out yesterday. And there's some really impressive projections as to what we could accomplish in a pretty short period of time.
4 to 6 weeks, maybe.
If we would just commit ourselves to following the guidelines in that policy. If we would do it for 4 weeks, we could
make a big difference.
Make a big difference.
Absolutely.
Concern levels would drop precipitously. So I guess my parting message, I hate masks, y'all. I hate wearing these things. They're hot, at least to me. It's hard for me to talk in one of these, which is why I'm wearing this thing right now. But if we will commit ourselves to doing this and commit the people around us to doing this, I think we can make a huge difference in the short term. And maybe a month from now, we can be talking about football season and not coronavirus, which I would very much like to do. Thank you all. Thanks for taking the time to be here. I'm telling you, we can handle this, y'all.
Thank you.